Hi, my name is Dinus Mickle, and I'm going to be asking a few questions about the coronavirus situation. Today is March 16th, 2020. I'm not sure when you're watching this, but I'm going to be using the structure of past, present, future to take a look at where we're at right now and where we want to be going. And the where we want to be going part, what I'm going to do is I'm going to look from the perspective of our great-grandchildren's generation, right? So what kind of world are we making for our great-grandchildren? Now, something that really struck me, I was just making a Facebook post and I was like, yeah, my daughter's school is going to be closed because and I wrote something like, because the subset of our population that's in the least amount of danger, we're going to prevent them from doing what exactly? And that led me down kind of a path of reasoning. Because I was kind of like, what? Wait, I thought, 100 years ago during the Spanish flu, I thought kids were dying, right? Like it wasn't, and I'm going to get the Spanish flu here. I was like, yeah, I checked on it. I'm like, yep, there it is. This is a chart for mortality and age, specific death rate between 25 and 34. You have a peak in death, and also from 0 to 4 years of age, you've got a lot of death, and then in the elderly. They're saying that normal pandemics just have this sort of, they impact the young and the old. That's from 1911 to 1917. And the Spanish flu thing really hit 25 to 34-year-olds in sort of an odd way, right? In a very unique way. So the question that I'm asking is there any scientific evidence whatsoever that closing schools, that closing schools would have a positive outcome for society, would reduce deaths? So you have a social dynamic, you have a social structure, you have a subset of the population, which is school-age kids. They go to school. These kids, they're not getting sick, they're not getting symptoms, and they're not dying. Okay? Overwhelming percentages and statistics showing that. So what do? You close schools. You disrupt something that's working. There's a rule: if it ain't broke, don't fix it. Why are we poking that subset of society? They're okay. They're okay going to school. They're okay meeting with each other. They're okay hugging each other and doing all the stuff that they're doing, sports. They're okay with all that. So that subset of society is healthy, doing what they're doing. Why are we changing it? Let's hope that closing schools has a positive outcome. But do we know? What is the science behind that? And if, 100 years ago, we don't have data, what data are we using? And what kinds of illnesses are we comparing the current bubbling up of symptoms to? What are we comparing it to? I asked this on social media, and the response is, well, children are vectors of disease. Like, that's really, really rude. That is really rude to kids to call them some type of disgusting pustules of nastiness. Why? Why? Well, everybody knows. No, I don't. My daughter has a reasonable diet. Yeah, sometimes she comes back with some kind of sniffles or something. It seems like something that she's picking up. I'm happy to have it at home because then I'm immune to what's going on or around. It's we have our own little family dynamic and we're chilly. I'm happy to become resistant to whatever happens to be going around. I mean, children are bringers of happiness, joy, jokes, singing, good questions. Why do children have to be, considered these disgusting vectors of disease, especially when they're not getting sick? Okay, so let's look at testing them. Let's look at testing asymptomatic people. Look at this, coming out of China. See full citation. This is March 5th, 2020, so this is 11 days ago. Coming right out of China, conclusions. In the close context of COVID-19 patients, nearly half or even more of the asymptomatic infected individuals reported in the active nucleic acid test screening might be false positives, right? So I had symptoms and I tried to get myself tested. I got yelled at. That also. So I'm just going to count up. I'm going to ask some questions. I'm going to count up some red flags. It raised a red flag for me that I couldn't get through to the hotline. It raised a red flag for me that they didn't care about testing me, even though I had direct contact with people from the areas of infection, right? And I don't have anything to give them anymore. I don't have any symptoms. I mean, this is over a week ago, right? So I don't know what to tell the authorities. I done had it already. I done did had this corona thing. So it was a red flag for me that they didn't care about getting me tested. So that made me think maybe the test doesn't matter. Maybe it's not a good test. Maybe it's not a good test. What happened? I looked up, what's the test? They generally use something called a polymerase chain reaction test. It's called a PCR test. This guy, Kerry Mullis, looked up a little bit of his biography. Very interesting character. Only passed, if I'm remembering correctly, August 19th of last year. It was August of last year. But won the Nobel Prize. Rest in peace, Dr. Mullis. In 40 years, doctors have never come up with any test more accurate than this very flawed theoretical estimate of microbial activity. Quantitative PCR is an oxymoron. PCR is intended to identify substances qualitatively, but by its very nature is unsuited for estimating numbers. Although there's a common misperception that viral load tests actually count the number of viruses in the blood, these tests cannot detect free infectious viruses at all. These tests cannot detect free infectious viruses at all. They can only detect proteins that are believed in some cases wrongly to be unique to HIV. The tests can detect genetic sequences of viruses, but not viruses themselves. But these tests cannot detect free infectious viruses at all. Okay, so is that the bottom one? PCR is not a test that isolates, identifies, or even detects any particular virus. If you're sick and have some viral fragments, the PCR test just amplifies those sequences millions of times from the sample. What does that mean? Is that sort of like, I can't understand what you're saying, so I'm going to take a recording of what you're saying, I'm going to amplify it 40 or a million times, then I'm going to blast that sound at some sand or something. I'm going to see what the sand looks like. I'm going to try to figure out what you were saying. So we're relying on this test, but this part of it, these tests cannot detect free infectious viruses at all. they can detect genetic sequences of viruses, but not viruses themselves. Okay, so, you're like, okay, well, let's go with this test being, the inventor of the test says stuff like that, but the people in China, Department of Epidemiology and Biostatistics, they're finding that for asymptomatic individuals, they're thinking that maybe half or even more than half of those tests could be false positives. Okay, and this is going to be, there's a here. It's a fact sheet. I have to do a little quick pause. Okay, so this is from yesterday's fact sheet for healthcare providers. New York SARS-CoV-2 real-time RT-PCR diagnostic model. So they're using the PCR test. What are the symptoms, et cetera, et cetera? What does it mean if the specimen tests positive for the virus? Positive test indicates that the RNA was detected and the patient is infected. Laboratory should be considered in the patient. Hold on. The New York SARS real-time RT-PCR diagnostic panel has been designed to minimize the likelihood of false positive test results. However, in the event of a false positive result. Okay, so they're saying there could be a false positive result. The test isn't good enough to, and then they're just saying what the patient needs to do if it's a false positive, but you don't know, there are no instructions here for the healthcare providers to determine whether it's a false positive, right? So I'm taking my car to the shop. The diagnostic says that the brake pads are worn. You check the brake pads and they're not worn, right? So you don't need to replace the brake pads because you check the brake pads. There's no equivalent here. There's no false positive, right? Not saying the brake pads are worn. You go in there, you look at the brake pads. You don't need to, you got this and this estimated, months of braking. It's not there. Now, what does it mean if the specimen tests negative? Negative, okay, that the RNA was not present in the specimen. How does RNA get into the specimen? How clean does the environment need to be? What is the testing environment like? Who is doing the testing? Does the tester have a dog? Apparently, if you're amplifying, if you're increasing 40 or a million times what's in a particular specimen, it's an interesting test, but there's a high probability of error, contamination. But here you go. However, a negative result does not rule out COVID-19 and should not be used as a sole basis for treatment. So, a negative result does not exclude the possibility of COVID-19. So, we have the handbook that says the positive doesn't necessarily mean a positive, and the negative doesn't necessarily mean a negative. Again, let's say that it's above 80% or it's doing some kind of percentage. And what kind of percentage are we talking about? If it's above 90, they probably wouldn't be using language like this. 10%? 10% false positive? Well, we had it right before here. Half. 50% false positives? 50% false positives? If it's 50% false positives, that reduces the death rate from COVID-19 by half, by the way. Okay? So, we take a very simple question like, does closing schools Does disrupting the social structure of a subset of society that is not showing symptoms, that is not dying, is it logical? Will it create a positive result? Start trying. You see models of quote unquote flattening the curve. Okay. You can find a, simulitis, but, simulitis is a simulation. Of course you can simulate something that's the conclusion first, right? I mean, you can put the conclusion ahead of the evidence if you want. That's 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 what that simulation is. You program it to show your conclusion. Okay, so we talked a little bit about the past and the present. We're at taking measures to protect 25 to 34-year-olds during the Spanish flu would make a lot of sense because they were at risk. Now, let's look at what we're doing. We disrupt school-aged children's society for a month because apparently we're trying to protect 75 to 85-year-olds. This is not something I've got prepared, so I'm going to try to find a statistic. Death or mortality by age, there it was, coronavirus. Let's look it up. That's February. Worldometers. So I got a few. And let's be really, unique. 2 days ago, I went to page 10 just to see. Okay, give me a chart. Overwhelmingly above 70. Okay. Overwhelmingly above 70 years old. Doesn't that mean that we should do something? Keep looking. +80-year-olds, 70-year-olds. Okay, some impact 60 to 69. Okay. Now, why are we socially disrupting people in the 10 to 19-year-olds range when from 60 to 80 plus are in danger? Why aren't we making changes to protect and help our 60, I'm not going to call elderly, pre-retirement, retired, and elderly, the elderly populations? There's like a what to do. There's like a CDC thing. What to do if you're sick. I can't believe how bad this article is. First of all, you're supposed to call your doctor. Steps to prevent the spread. We don't, what to do if you're sick. Stay home, avoid public areas, avoid public transportation. What about what to do? What about something therapeutic? Separate yourself. That's not therapy. Call ahead before visiting your doctor. Okay. Wear a face mask. Okay. Cover, dispose, wash hands. Clean your hands. Wear something therapeutic. Avoid sharing personal household items. So, cleaning, high touch. What do you do? Monitor your symptoms. Okay. Discontinuing home isolation. Footnote. Not a single therapeutic word. Not even go get cough drops. Warm wrap around the neck. find somebody else who's sick and give each other massages. Have some hot tea. Have some soup. Have your vitamin C. Where's this one? There's the whole vitamin C. Vitamin C is very promising for prevention and especially important to treat dying patients when there's no better treatment. Over 2,000 people have died of COVID-19 outbreak and have not yet seen or heard large dose intravenous vitamin C being used in any of the cases. The current sole focus on vaccine and specific antiviral drugs for epidemics is misplaced. Early and sufficiently large doses of intravenous vitamin C are critical. There's a doctor in China that was doing intravenous vitamin C and is just saying, hey, world, look, we're effectively treating we're effectively treating these people with intravenous vitamin C. What does the CDC say if you're sick? None. They don't even mention vitamin C. So we need to be protecting and helping the 60+ segment of our population. What's happening? It's terrifying. Look at this. Let's do this one first. They're barricading a screaming woman into her home with iron bars to supposedly stop coronavirus from spreading. I'm not going to turn the sound on. They're barricading her in. So, societally, we should be helping, especially people who are 80+ years old. We have a test that's suspect at best. Look at this. If you turn on the sound, she's screaming. She's in there screaming. They're barricading a person in. Okay? For what? For having a temperature? Is that okay? So we're looking at this from a perspective of past, present, and future. That's happening present. That happened, whatever, the day before yesterday. What kind of world do we want for our great-grandchildren? Is it illegal to have a temperature? Look what happened here. You had 86 people die of the virus in one day. Now then I looked up how many people die. Where is this? How many people die per day in the world? 150,000 people die every day. This is with our population. China is going to be about a fifth of the population. There's 30,000 people. I saw somewhere 25,000 people die per day in China of stuff. So that's how many people there are, and that's how many people die. So, 86 people die of supposedly this virus, where we've got, let's say, a 50% chance of it being correctly determined by the PCR test. So, whatever, 43 people died. We don't know. Well, let's say it is 86 people. That's 86 out of the 25,000 people that died that day. Okay, so what are we doing? Look at this. So that person there running, they're supposed to go to quarantine camps. They're running, they're chasing this person. Okay, why are they, look, this person being dragged. There's somebody being dragged, forcibly detained by force. Here you go. These are the types of people. China has demanded 4 types of people in Wuhan to be put into mandatory isolation and quarantine stations. Confirmed cases with whatever percentage of accuracy of the test. Suspected cases, if you have a cold. People who've had close contact with the former 2. And those who have a fever. If you have a fever, Now, where are you going to have a better chance of recovery? A place like this hospital, whatever that is, in some barracks. I'm telling you, I do really badly in group barrack situations. I always get sick. Ever since even I was a teenager traveling in Europe, I'd either stay with people that I'm friends with, but sort of the youth hostel thing, I'd always pay extra to get my own room, for us to get our own room, so we wouldn't have to share a room with strangers. So is this what we want to experience ourselves, our children, our great-grandchildren, our grandchildren, our great-grandchildren? This person running, let's say he brought some soup to his mother, who has a fever. Let's say he brought some soup to his mom, who's got COVID-19 for sure. So now, because he brought some soup to his mom, he gets chased, caught, detained. This is a different person, but the outcome's the same. Dragged to a containment facility for having close contact with his mom and bringing her some soup. Only way you can bring your dying mom a soup is if you wear a hazmat suit. Is that the future that we're making? We click through a few things. Yeah. Disrupt the social structure of children who are not getting sick. Let's hope they don't get sick. Let's hope that children don't now start getting sick because we've disrupted their rhythm, eating, and social structure, and their own sort of family herd immunity thing for going to school, interacting. Okay, here's the PCR test stuff, how they're doing it. That was me looking for, these are the treatments. Okay, this is what is this? This is me thinking, hey, and maybe I could buy one of these units and bring her to my mom if she would need it. And for me right now, this person getting chased really, really concerns me, because we have a social obligation to help the subsets of our population that are currently in need. Sometimes it's, we need to help our vets who have mental health issues. We need to help the elderly now. We need to, help them get through whatever this is. And in a sense, it doesn't really matter. Is it 5G? Are these symptoms coming from electromagnetic frequencies being used for telecommunications? If so, we've got a culprit. We've got someone to point the finger to. We've got people to jail. We've got people to arrest. We've got people to hold accountable. Is it developed by Bill Gates because he's a eugenicist maniac who wants to depopulate the earth? Okay, well then we've got a guilty party, right? We've got somebody to arrest, to detain, to question. We've got steps of investigations that we can take to take a look at what's causing this, and is there someone responsible? Is it a natural virus that came from bats or from unhygienic practices or something like that, and that's somehow transferred from one person to the next? Okay, maybe. Is it from different kinds of poisons or toxins in the environment, and is this whole communicability of disease through the germ theory, not just that's how the diseases are communicated. Is that something to be questioned? And are viruses more like, the garbage men of our the sanitation staff of our bodies? All that's interesting, right? But we predictably have no endangerment to under 60-year-olds. I'm under 60. My mom is close to 80. It is my obligation to take care of my mother. It is the children and grandchildren and great-grandchildren. It's our job to go and take care of our parents and our grandparents and great-grandparents. That gets us chased by the cops and stuck into a multi-bed facility. Next, all right, and where's anything therapeutic? We have strong evidence. Where's this one? Wow, look at this. To be blunt, not sharing or withholding information from the public of potential treatments should be seen as negligence. Vitamin C is not new. It's available and has been proven and used as an antiviral since the 30s, etc., etc., etc. So grandma and grandpa need to be taking their vitamin C. How are they going to get it? They like orange juice. They like apple juice. I don't know. I think broccoli's got some vitamin C. It's got some protein. Who cares, right? So do what works for you. Now, I had these symptoms. I had a fever, and then I had about 3 days of constricted breathing. I could see how that would create panic. If you have elderly, like for me, what's missing here is I'm under 60. I had some kind of cold. I couldn't get them to test me. I could have 15 oxygen tanks at I could be the neighborhood oxygen guy. I'll be the neighborhood oxygen guy. I've already told my neighbors I'll go shopping for them. Where's anything therapeutic? Where's our societal movement and voice saying let's do what we can besides prevention to be able to treat and take care of the population that is currently in danger? If it were kids, we'd need to be protecting our kids. If it were something that we're suspecting is transmitted at school, then of course we should be shutting down schools. But we're taking an entire ecosystem that's working, that's not endangering kids, and we're shutting down their social ecosystem. We're shutting down, we're endangering their herd immunity is what we're doing. Let's hope that it has a positive effect. Flatten the curve. I've only seen models. I mean, so then we have social distancing. Okay, that's a term. What about looking at the opposite? Closeness. What does that look like? Let's take just a theoretical, multi-generational family. Great-grandparents, grandparents, kids. Right, so 4 generations or 3 generations. How are those households doing? Now it's March 16th, 2020. Let's say this pandemic passes. What are the statistics going to be, and is there going to be some type of analysis done on multi-generational homes where a grandchild might make some tea and the child will make some soup for grandma and grandpa, Maybe a nice, hot, warm towel around the neck, some good herbs and some oils, and nice massage of the chest area for those 3 days where the breathing is constricted because of this virus thing. Or is it 5G being turned on and then, it gets turned on and people have this, physiological reaction? It doesn't really matter what the disturbing factor is. It doesn't matter if it's 5G. It doesn't matter if it's a virus. It doesn't matter if Bill Gates made the virus. It doesn't matter if it came out of a bat. It doesn't matter. If it's a pig, African pig, they've got African pig flu coming. It doesn't matter. I mean, it does matter if we want to find a criminal and arrest and detain criminals. But I'm talking about taking care of the people that we care about. And this is what's starting to really get to me, is I think there's a travel restriction. If my mom starts exhibiting symptoms and I get told that I can't go and take care of her, I'll be pressing charges. My mom feels great, but I'm going to be by her side. And the social distancing is one thing, but if we look at, let's go back to, where's this history? That was the wrong one. History again. Is this one it? There. Unfortunately, it's not the graph that goes like this. These are the people we need to be helping: 80 plus, 70, 79, 60 to 69. The rest of us who are healthy need to be prepared to help those who need our help. And yes, it is relevant. How many months or years are we extending their lives? End-of-life care is a political issue. It's an important issue. With or without this COVID-19 5G factor, how much longer would they live completely without it? 4 months? 2 years? Not 10. Not going to be an average of 10 years, I'll tell you that. Because the 80-plus-year-olds are dying, apparently, of this. Are they dying then of the intubation pneumonia? Or are they dying of this? Then we're back to whether the test has any efficacy whatsoever. Does it work? Does it actually show what we think that it's showing? That gets really, really disconcerting and really, really unsettling. So, to come back to past, present, future, I took a look at the Spanish flu. Spanish flu, with the way that the Spanish flu looked, it would make sense to make a change in how, well, here's 5 to 14 was the lowest, but in how 25 to 35-year-olds behave, right? How children are treated and how the elderly are treated. Now, for this corona situation, we've got people who are not in danger, that if factors don't change, we're to care for the elderly. If we're caring for the elderly and the sick, is being barricaded into your home, is that being cared for? Is this kind of, bed, look how many beds there are in this picture. 1, 2, 3, 4, 5, 6, 7, 8. That's 16. That's going to be 24. What's this? These are bunk beds. That's 32. That's 40 beds in a room. Oh my gosh. I'd get sick just walking into there. Ugh. For what? For me taking care of my mom? That's how this guy here has a mask. What is that? That guy went and took care of his mom, so now he has to be in a quarantine? And then what? Is he going to go to his job? Just go right back outside. They're born anyway. Won't these people be doing better at home? What about in-home care? And then what to do if you're sick? Only you do, basically, there's nothing therapeutic here. Call your doctor. Okay, what's your doctor going to say? I don't know, take a Tylenol? Okay, soup, steam inhalation, anything that frees up the shoulders, massage. Maybe you get a chiropractic adjustment. Do what works for you. Dude, I shouldn't be drinking this coffee because this has me completely excited. But do the things that calm you down. Do the things that I've got, cough drops that I really like. Have your favorite cough drops. And how can we help our 80-plus-year-olds, our 70, 79-year-olds, 60 to 69-year-olds? I'm not seeing therapeutic suggestions being made. And that bothers me. Let's go through the red flags. Red flag, warning, do school closings have any kind of impact in quote-unquote flattening the curve? Okay. I've only seen theoretical models. I have not been able to find any concrete information from anyone I've spoken with, doctors, specialists, and just I've asked as many people as I could to try to figure out if the school closings can predictably have a meaningful impact on quote-unquote flattening the curve of this death rate. Next, okay, the test itself. Suspect. Okay. The test is producing false positives and false negatives. At what percentage is unknown, but that there are false positives, false negatives is known. Okay, that's a red flag in a big way. Now, how are we caring for and what are we doing with the subset of our population that's in danger? Sticking them in facilities like this? First of all, the one that's not in danger, we're treating them like they're some kind of toxins, like children are some kind of toxins. I don't think my daughter's a toxin, okay? I like kids. They're bright, they're happy, they ask good questions, they're fun to be around. They're smart, they're learning. I think kids are wonderful. Okay, the elderly. You can learn a lot from the elderly. And so then around, May, April, June 2020, a question to ask will be, were there any households that are multi-generational? And how did they do? And were there any coronavirus deaths in multi-generational homes? And if you're going to take your last breath, do you want to be in a hospital hallway? Do you want to get wrestled to the ground? What, and these people fogging stuff? You want to get wrestled to the ground? Is that how you want your grandparents to die? Is that what we want to leave for our, empty streets at the sign of a new sniffles? Is this what we want for our great-grandchildren? Look at this. Beds, 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 beds. What's the difference between those beds there in like a parking lot and then being at home? Panic, 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 panic. A weird gun that you point at a person's head to see if they have a temperature. Look at this. They have one that really looks like a gun. This is completely threatening. And then you're doing that to the people exhibiting symptoms, they're not guilty. They haven't committed any crime. You're detaining them. This person went and, theoretically, went and brought his mother some soup. His mother has a fever. Neighbor told a neighbor. Now the cops are chasing him. So another potential is to be close to our elderly, to make some soup, to prepare the medications that they take, to maybe even prepare some type of breathing apparatus. Buy one, have one available. Learn how to intubate if that's a possibility, or find out who among your friends is able to provide that kind of medical service at home. There we go. There. Do you want to be at Grandma and Grandpa's bedside, with uncomfortable and smiling? Have a nice conversation before they pass? Or do you want Grandma and Grandpa to be wrestled to the ground? And what about you? What about when it's your turn? You know, what about when you're the endangered population? Want to be in a cold hospital hallway, like a parking lot makeshift? It's sprayed. I'm telling you, I don't like harsh chemicals. Disinfectants make my nose dry. I get sick around harsh chemicals. So it's just something I'm putting out there for consideration. And around June 2020, it would be really interesting to get an assessment from multi-generational households, how they did. I am questioning the logic behind social distancing, but there's another graph that I saw that pointed to it truly reducing the spike of cases and mortality. And that then would be an appropriate step. But does it make sense to shut down schools when that subpopulation is fine? I think that's a reasonable question. I don't see communities rallying to help each other, to know who's in danger around you, to see increased dependence on hospitals and government care. What about in-home care, in-home treatment? What about preparation? One preparation that we know is to take vitamin C. So drink your orange juice, right? Make sure Grandma and Grandpa have a lot of vitamin C. And what to do if you're sick? It's got nothing there for, doesn't say vitamin C. Is it going to say vitamin? Let's search for vitamin. Not vitamin. What about rest? There's rest. Let's see what that is. Actually, already did. You should restrict and restrict. But what about rest? Is the word rest? No. So vitamin C isn't mentioned on the cdc.gov coronavirus, what to do if you're sick. Rest isn't mentioned. I wonder if hydration is mentioned. Nope. Water? Washing water. What? Drinking water. Soap and water, soap and water, soap and water, soap and water. Be aware of what kind of water you're drinking. Try to get some natural spring water. Try not to drink chlorinated water. You know, look at what hydrates you the best. Any version of from distilled to spring water to bottled water to boiled water. You know, make sure that you have something that hydrates you, that makes you feel great. Ask grandma and grandpa what hydrates them the best. Doesn't matter. Wine actually dehydrates. Beer dehydrates as well. But, you know, I mean, they're 80. Give them a hot toddy. Give them what they want. They're 80. And try to get them hydrated. A lot of people above 80, pretty stubborn. You know, they're going to do what they're going to do. Coffee actually dehydrates. They drink coffee all day. They're 80. So try, you know, but at least you're there helping. And getting wrestled to the ground. This person's not above 80. So this person was probably helping grandma. You're wrestling people to the ground because they helped grandma? That's terrifying. So now I'm going to past, present, and future. I'm going to our great-grandchildren's, great-grandchildren's generation. To have a world that works for our great-grandchildren. When we have epidemics, we should be taking care of the people who are in danger. Not saying that a future epidemic won't threaten children, but this one doesn't. So children should be helping those who are in danger. And in this case, I'm under 60, so I count as a child. I'm in the not endangered population. So I'm here to help others. And helping, I mean, it would almost be like we could consider everybody above 60, everybody's infected, right? If everybody's infected now, what do we do? What can we prepare? And how can we be there for the elderly and for the dying? I think that we're missing so much. We're not only missing a lot physically in this social discussion in terms of soup and hydration, having the proper medications, having the ventilators if we need them, you know, preparing for 3 to 5 days of the elderly having a tough time breathing. So we're physically missing a lot of what would be wise to have. A vitamin C, you know, like that's the physical level. But let's look at emotional, right? For goodness sakes, when you feel like you can't breathe, that can cause panic. So physically, a nice warm towel around the neck and give a nice massage to the upper chest area, a smile, emotional care and love. That can only help. Moving on through, you know, cognitive types of things, we should probably have accurate tests. We should probably know what's happening. Going further along the line spiritually, prayer, meditation, and centering. I mean, where's that? Where's the what to do? You know, what to do if you're sick. Pray and sing with your family and be hydrated and get enough rest. You know, talk to your loved ones. Tell them that you love them. Nothing. Just call your doctor. So I'm pretty disappointed in that. And so for designing a positive future for our grandchildren, I'm going to do a plug for togetherness and reciprocity and love, truth, companionship, care, and taking care of each other. Okay, so let's see how multi-generational households do. Let's take a look in summer 2020. Thank you for your time and attention.